I'm here with Michael Klotz, a veteran healthcare IT entrepreneur, consultant, and expert in interoperability. With interoperability being a hot topic in healthcare IT, and Michael and I believe that this is for a good reason. As we notice in many situations, even with healthcare insiders, that we are lacking a common understanding or definition, if you will, of interoperability in healthcare. So Michael, how would you define interoperability?
Well, Reid, I would say a comprehensive way of defining interoperability should include factors like scope, formal definition, context, related characteristics such as standards, rules, and technologies, as well as key stakeholders and key use cases. For today's conversation, I want to focus on scope and definition. The scope of the data and transmissions that we typically consider part of interoperability are really limited to clinical data. A good way to look at that is to say, the standards that are used primarily with interoperability are HL7CC CCDA and the FHIR standard that's rapidly emerging, as well as legislation and rules around the HITECH Act of 2009, which gave us meaningful use rules, which came out of the sponsorship of the adoption of EMRs, and now the 21st Century Cures Act of 2016, which gives us the common framework and information blocking rules and other important rules defining interoperability. Contrast that with the administrative data set, which is defined by the X12, ANSI X12 EDI standard, and is mostly defined by the HIPAA Act of 1996. Then in between those two, we have claims attachments. While claims attachments really are defined in the administrative data set, they contain clinical data, so they sort of belong in both places or somewhere in between. But over time, hopefully, the two merge together as we move towards more integrated systems, and that distinction won't matter so much anymore. As far as a definition, we're looking at the definition that HIMSS published earlier this year, or actually a draft of that definition, which is a good attempt of defining interoperability. It talks about information systems, devices, and applications that need to connect. It talks about the need to access data, exchange, and use that data, obviously within the context of security and privacy, and the goal of optimizing the health of individuals and populations, which is really why we're doing what we're doing. I think that is a good high-level overview of interoperability to get started.
I agree with you, Michael, and this is very helpful, and I look forward to our next talk.